Welcome back to Good Day State Line. Tonight we're catching up with our friends from Transitions Care. Alicia Bobak is with us. Hi, Alicia.
Hi, good morning.
Okay, so tell us a little bit about what you do with the transitions.
Sure, my name is Alicia Bobak, and I'm currently the Vice President of Operations for Transitions Home Medical Group. I do work with Dr. Kapoor, who is our Medical Director for Transitions Care, to strengthen services in primary and palliative care, and that includes our chronic care management program.
Yeah, so I know tonight we want to talk about the chronic care management. Tell me exactly what that means.
Sure. So chronic care management is an integrated care approach to managing chronic diseases for individuals who are on primary and palliative services. Chronic diseases can include a long list. Some off the top of my head are chronic heart failure, COPD, diabetes, hypertension, things that may exacerbate and patients are being seen in the hospital for frequently.
So how does that fit in with a transitions program?
Sure. So our chronic care management program functions by having a clinical coordinator that is trained and is an LPN, and they are assigned to a specific patient in which they see all coordination of care for this patient. It can include screenings, medication checkups, monitoring symptoms. What is unique about our program is that we empower the patients to participate in their plan of care by setting personal goals. So one patient who has diabetes goals may be different from another patient's goals for their diabetes. We also provide 24/7 access to a clinician and have an extended care team that is available throughout the night and on weekends to go into a patient's home if there is a clinical concern or an issue that may come up.
So what do you think makes this a unique program for transitions that's maybe not out there for other programs?
Sure. So I think that 24/7 access is huge. There may not be availability for a 24/7 on-call nurse practitioner that can do a telemedicine visit at 2 a.m. or maybe a Saturday at 6 p.m. So we have those services available all the time.
And those services are so important to each individual. And I know that, having those services actually leads to more positive outcomes. Can you tell us a little bit about that?
Correct. So having those services along with our chronic care management program enables our team to be highly engaged in managing the patient's ongoing health. It's designed to improve health by simplifying care and providing that support that may not be there, especially in rural areas. The benefits are being more personalized for each patient, proactive, and better quality of life by improving the patient's outcomes and reducing costs and unnecessary ER visits.
So what do you think is your favorite, thing about working with transitions and being part of this team?
So my favorite part is the collaboration. So even I worked as a nurse practitioner for transitions, so I do have that home health experience, and the support I received from the medical director and the supervisors as far as managers really helped fulfill, my goals in my career, and they really see the patient's need and quality of care as number one.
Absolutely. Okay, if anyone who is watching tonight wants to get more information from Transitions and see what you guys are all about, where can we get in contact with you?
You can go on our website. It's actually brand new, Transitions Care. It has all the information about our services via email or telephone.
Great. Thank you so much for joining us tonight, Alicia.
Thank you.
Coming up next, we'll hear more about this year's 815 A Rising Stars talent show, and then it's Tuesday Trends with the Summerfield Zoo. We'll be right back.